Dr. Gyanendra Gongal. He has worked for Nepal government from 1988 to 2006 in various capacities under Ministry of Health and Population and the Ministry of Agriculture and Cooperatives. Affiliated with World Health Organization since May 2006 as a veterinary public health expert. A founder of Trust for Zoonosis and Consumer Awareness in Nepal and has worked for rabies awareness, education, and communication in Nepal and India. Honorary member of Association for Prevention and Control of Rabies in India, Foundation for Human Rabies Education and Eradication, and a life member of Nepal Veterinary Association. An expert in epidemiology, veterinary public health, zoonosis, and food safety, Dr. Gyanendra Gongal is currently working as the Regional Advisor Food Safety, World Health Organization, Regional Office for Southeast Asia. I humbly invite you, sir, for the keynote address.
Thank you very much. I hope you can see the slide. First of all, I would like to congratulate IVSA as well as fellow veterinarian and medical doctors who are participating in this World One Health Day event. And I am happy to be part of Kerala Veterinary and Animal Science University to develop master's course on One Health nearly 8 to 9 years back. And I could see a lot of progress, and that is great to acknowledge. And to talk about veterinary education and veterinary services, during 60s, it started with VCI. It is not Veterinary Council of India. Vaccination, castration, and artificial insemination. But now, because of this transformation and expansion of livestock industry and diversification of production system, now we are talking about herd health management, trade, and risk-based inspection, and so on. So it is my great pleasure to deliver keynote address on One Health multidisciplinary approach at the human-animal interface. During my presentation, I will try to highlight the zoonosis at the human-animal interface, One Health as problem solution-based approach, how international movement was developed for One Health, and FAO WHO as tripartite commitment for One Health, and what are the priority area for One Health collaboration and take-home message. It has been already mentioned that these many diseases are emerging in human from time to time, and it is because of breaches in species barrier. So you can see the list of diseases we have been recording since 1976. It includes Ebola, HIV/AIDS, E. coli, HIV-2, and Hendra virus, BSE, H1N1, Nipah, SARS, influenza, H1N1 2009, severe fever with thrombocytopenia syndrome, MERS-CoV, and so on. And this is going to happen from time to time. And the frequency of all emerging these events have significantly increased since 1940 and reaching a peak in 1980 and 1990, and that is continued for many years. And 61% of these are caused by the transmission from animals, and 74% of these are from wildlife. That is the major thing we have to understand. And zoonotic EIDs from wildlife reach highest proportion in recent decades. And we see the like epidemiological triage. We have wildlife, domestic animals, and human. And there are ambient environment, a conducive environment for transmission of disease from wildlife, domestic animal to human, like translocation. In Central America, at least the sugarcane was major this cultivation, and they had a lot of snakes, and that's why they introduced mongoose from South Africa and India, to get rid of, to tackle with this snake, and then they introduce rabies. Similarly, in South America, they expanded dairy farming as well as beef, this cattle farming. And because of that, vampire bat rabies, that become major issue because of development aspect. And there is also deforestation, and there is also wildlife hunting, like bushmeat in Africa, and we have global travel, urbanization, and there is also technology, like we have listeria now, which can survive in our refrigerator. And there is also intensification of agriculture that may lead to this compromised immunity among poultry in this industrial system. So that's why we are getting many diseases like avian influenza and some others. And here we have to understand that we are living in globalized world, interactive, interconnected, and interdependent process is happening. Because of that, there is disease emergence, re-emergence, and persistence. So we have to understand human domain, animal domain, environmental domain. And this is an interactive process, and that's why we are getting many diseases like plague has been detected in Libya after 30 years. And similarly, it is happening in many parts of the world, like Zika virus and chikungunya. It appears after many years, but in different form. And this is happening because of animal-human ecosystem interface. Usually it is localized in forests like sylvatic plague or sylvatic rabies or sylvatic dengue fever. And then when there is some kind of event like climate change or flooding or earthquake or encroachment of their habitat, then they may enter our domestic animals. Like Japanese encephalitis, we know that it happens to egret and heron, and then that infect pigs. And because of this Culex mosquitoes, they bite human being, and there is human amplification. So there are many examples. So that is very important to understand that if there is a spillover of this new zoonotic pathogen from time to time, and if we do not have a good surveillance system and intersectoral coordination, it will be emerging from time to time, like CCHF, Crimean Congo hemorrhage fever, and many other diseases. They are happening, Rift Valley fever and leptospirosis, and there are so many diseases. And unfortunately, Asia Pacific region, it is a major hot spot for emerging infectious diseases. Gangetic Plain, Mekong Basin, that is known as hot spot, and there is an outbreak of zoonotic disease like Nipah. It happened in Kerala also some time ago, and some other diseases. And there is also from domestic animal like avian influenza, anthrax, these are happening. Similarly, drug resistance, Yandium, these are emerging in Asia Pacific region. And last but not least, vector-borne diseases, they are also emerging in our region because of globalization, urbanization, and intensification of agriculture system. And we create ambient, conducive environment for the breeding and resting of our vectors. That's why we have to deal with those diseases. And there is huge economic impact of infectious diseases outbreaks. We know SARS, how it happened, and H5N1, H1N1, and Ebola in Africa, and Zika recently, GB syndrome and microcephaly. Those are the problems we are facing. And now COVID-19. That is a classical example that how disease can impact our life and our economy and our behavior. And what is One Health? There is no standard definition. US CDC Atlanta, they came up with a collaborative, multi-sectoral and multidisciplinary approach, working at local, regional, national, and global level with the goal of achieving optimal health outcome, recognize the interconnection between human, animal, plant, and their shared environment. From public health perspective, we can say that the prevention of human disease through the control of infection and disease in animal population within all ecosystem. That animal population means it is wildlife as well as domestic. So here, when we talk about One Health, it is not revolutionary idea. This is not new idea. It is working together culture. So we are not going to create new system, but realign existing system, creating necessary linkage for data and action sharing. That we have to understand. We are not going to create superstructure. And there is metamorphosis of One Health. I am pleased to inform you that there was international ministerial conference on avian and pandemic influenza in New Delhi in 2007, and the member states, they realized that there is a need for holistic multidisciplinary approach in the wake of avian influenza crisis. Yes, avian influenza H5N1, it happened in poultry. There it is fatal disease, but human is also victim of avian influenza directly from poultry to human being. And we also have another H7N9, which is not symptomatic in poultry, but human as work as a sentinel. And there was in Campi 2008 in Sharm el-Sheikh, where FAO, OIE, WHO, UNICEF, and United Nations, this Influenza Coordination Committee, and World Bank came up with a strategic framework for One World, One Health. And then there were technical consultation to further discuss strategic framework at Winnipeg and Stone Mountain in USA. Then we had Winnipeg in Campi. It was known as International Minister Conference on Animal and Pandemic Influenza, because we already have this H1N1 outbreak in North America. And it happened in Hanoi. WHO, FAO, OIE, we came up with tripartite concept note to advocate One Health. And first One Health conference, it was happened in Melbourne, 2011. And there was also a high-level technical meeting, how to operationalize One Health in Cancun in Mexico. And they identified rabies, zoonotic influenza, and EMR as priority areas. So FAO, WHO, we are all working together. In 2008, there was a strategic framework, and 2010, there was concept note, and 2017, there was tripartite commitment to work together to bring different sectors together to have solution-based approach. And in 2018, we came up with a tripartite guide into addressing zoonotic diseases in countries. So that has been used, and now we came up with a joint risk assessment tool that we are trying to through pilot project. And what are the priority area for operations of One Health? Zoonotic influenza, rabies, antimicrobial resistance, and food safety. And that's why we have Asia Pacific One Health Coordination Group, and we are working together. And this tripartite coordination mechanism, it is at global level. FAO, WHO headquarters, they have global tripartite secretariat. As I mentioned, in Asia, we have tripartite One Health Coordination Group. And at country level, we have Ministry of Health, Agriculture, Environment, and our focal point at the country level. What are the steps in putting One Health approach? It is a long way to go. First, we have advocacy that should lead to policy change, that we should try to facilitate legally as well as administratively, that we have to work together, policy change, and then we must change our behavior. So we have to think out of the box, and we should understand that there is a need of holistic approach, and we should develop network so that we avoid duplication and synergize our action. And what are the 5 critical steps in establishing One Health system? First is consensus among stakeholders. That is the basic thing. Then collaboration among professionals, cooperation among interdisciplinary groups, and commitment, political as well as financial. You may have excellent plan, but if there is no funding, it doesn't work. And last but not least, coordination among partners. Different partners may be involved, and they should not work in silo. They should try to help governments to implement One Health strategic framework. it is ideal, under ideal, our ideal expectation is that coordination, collaboration, communication between human and animal health sector for joint planning, investigation, control of zoonotic diseases or problem of common interest like antimicrobial resistance. But in reality, it is not uncommon to see the two sectors here, human health, animal health sector, in normal mode, working separately, and for the worst case scenario, may even work in different direction under different plans. And there is also lack of coordination at field level. But during crisis mode or wartime, incomplete data from investigation to link human cases with animal cases. Communication to the public. Everybody is talking in their one way that we can discuss separately. And this control implementation working without taking into consideration any possible socioeconomic consequences and regulation that involve. And I can give you one classical example of COVID-19 social media and side effect. There are a lot of information coming through social media, coming to various networks. And there is international media coverage of wet market in China as source of COVID-19. That means animal are source of COVID-19. Still, we do not have definite answer to talk about origin of virus. First cases of COVID-19 reported in Kerala on 30 January 2020. And rumor began in the first week of February that in particular in social media, linking poultry birds as possible vector of the virus. And there was COVID-19 rumor, fake news plus lockdown. And definitely poultry industry, particular broiler industry, it is time bound, you see. So you cannot keep more than 6 to 8 weeks, and there is economic consequences. And because of this condition, there was pathetic situation. Estimated economic loss in poultry sector due to COVID-19 rumor was considered as more than 3 billion by economists. And our colleague, Professor Nadim from Karnataka, he mentioned that in my 40 years of experience, I have not witnessed such a disaster. This is the pathetic situation, and there was great loss, which is considered as side effect. And even these cold drinks and ice cream, we should not consume. That kind of message was delivered. And what are the practical approaches? Joint formulation of plan to deal with specific diseases or in general, capacity building at professional and paraprofessional level, and networking and information exchange. So harmonization, investigation, and laboratory diagnosis procedure, sharing information, communicating official disease information, as well as rumors, and networking of public and animal laboratory, use of medical and veterinary academic institutions for disease management. Those are the things we have to understand. And we should be proactive rather than reactive. So there should be GIS system, remote sensing, forecasting readiness, and there should be sentinel surveillance for early detection, and then rapid response and control strategy. So before, during, and after, even risk communication messages, we have to develop accordingly. What is happening in India? NCDC and Department of Animal Husbandry, they came up with priority, One Health priority diseases, rabies, leptospirosis, plague, brucellosis, and anthrax. And there was One Health India conference in 2019. One Health roadmap for India was developed by Department of Biotechnology, and they identified anthrax, brucellosis, tuberculosis, and rabies as priority zoonosis, AMR, and they also try to discuss about One Health surveillance, laboratory diagnosis, biosafety and biosecurity, burden of disease to make investment case, intersectoral collaboration. And there are many national action plans for AMR, for influenza, rabies, and health security. All of them focus on need of One Health approach. And ICMR and ICAR collaborating for joint research priorities, and they have established National Institute of Zoonosis in Nagpur, and they try to promote joint these research projects. And what is the take-home message? One Health is not a new concept, but a life experience. And these events are reminding us that we must work together to save time, to save cost, and to be effective. And there is a growing recognition of One Health. However, it has to be translated from concept into action through country-level activities. Ownership, leadership, and partnership, these are the critical for successful One Health collaboration. We have One Health champion, a local champion, and we should try to promote them and try to support local initiative. And we always consider biomedical approach, but with COVID-19, I have already indicated that how social media, how consumer psychology is changing. That's why we have to see socioeconomic dimension of emerging diseases, including zoonosis. We have to think globally, but act locally. We have to consider local context. And one size does not fit for all. And last but not least, One Health is working together culture, and it is applicable for any place thing which require multi-sectoral collaboration. Now people are talking about planetary health also. So climate change, zoonosis, EMR, food safety, non-communicable diseases like cancer and environment, we can use One Health approach. Thank you.
Yeah, Krishnendu, please continue.
Yes. Thank you, sir, for the insights.